Hello, everybody. Welcome to the Seffiline webinar. First of all, as a member of the Seffiline team, I wish to welcome the participants. The topic of this presentation is the 3.0 version of the SEFFILLER and SEFFIAIR kits. Before we start, I would like to repeat some technical information on the webinar. Your microphone will be muted by our webmaster. We recommend to write your questions in the chat locating on the bar at the bottom of your screen, so we can possibly answer them at the end of the presentation or by mail. The first speaker is Dr. Alessandro Gennai. He is an Italian plastic surgeon. He is a pioneer in the regenerative therapy. He standardized and published SEFFI and micro-SEFFI techniques and developed the Seffiline kits. The second speaker is Dr. Rosalba Russo. She's an Italian aesthetic physician. She is acknowledged as one of the greatest world experts on the threads treatment for medical facial rejuvenation. She developed the new concept of medical lift, the combination of the threads and SEFFILLER technique. And now I leave the floor to Dr. Alessandro Gennai.
Okay. Good morning, everybody. Now I'm going to my presentation. Okay. Okay. Everybody can see my presentation? Yes, I guess. Okay. Good morning, everybody, or good afternoon. I don't know your time. And it's a pleasure for me to introduce you to the SEFFILLER 3.0 and SEFFIAIR 3.0. Before to introduce you these new kits, I wish to present my experience in regenerative autologous aesthetic medicine. And so we are going to spend some time talking about this topic. Sorry, I tried to. Okay, let me go back. Okay, autologous regenerative medicine use the power of stromal vascular fraction and mesenchymal adipose-derived stem cells to regenerate tissue and restore the volume. This procedure, the regenerative aesthetic medicine, is an autologous homologous tissue graft, and it is a cosmetic, minimally invasive procedure. I think that the autologous regenerative aesthetic medicine now is the most powerful and safest anti-aging tissue treatment. And moreover, it is opening the real golden age for aesthetic medicine. If you look over this plastic surgery statistic report, you can see that the surgical procedure is decreasing more or less 5% per year. In the other hand, we can see that the cosmetic minimally invasive procedure is increasing more than 200% per year. If you look also the global regenerative medicine market, you can see that we'll reach 30 billion euro in 2020, and the compound annual growth rate is more than 20%. Of this market, the regenerative aesthetic medicine is at 6.5 billion in 2020. And the part of the 6.5 billion in the world, Europe represents 1.2 billion. And so it's a really big market and a big, it's a 20% increasing in the next year per year. Talking about the golden age, we have to know which is our gold. Our gold is adipose tissue. Adipose tissue is a tissue is composed by several kinds of cells, and we can share in two big families, the mature adipocytes and the stromal vascular fraction. The stromal vascular fraction is the real golden nuggets of our tissue. Inside the stromal vascular fraction, we can find the adipose-derived stem cells, fibroblasts, pericytes, preadipocytes, but also granulocyte, endothelial cells, hematopoietic cells. And the stromal vascular fraction make the regenerative therapy is a tissue graft and not merely a fat graft. It's very important when we talk about the regenerative therapy, we have to know that this therapy is dose dependent. And so it's extremely important to know how much cells we are going to administrate to our patient. And so we have to know that in 1 ml of adipose tissue, you will find more or less 500,000, 2 million of cells of the stromal vascular fraction. And 1 to 10% of these cells are adipose-derived stem cells. The property of the stromal vascular fraction is the capacity of differentiate from the stem cells to the adult lineage, mesenchymal lineage, adipocytes, chondrocytes, osteocytes, the production of collagen and glucosaminoglycan by the fibroblast, the capacity of secretion of the growth factor as the vascular endothelial growth factor, so angiogenic activity, the capacity of homing, the stem cells move to the part of the tissue is more injured, and the antifibrotic activity too. All these properties determine an enhancement in volume in the tissue, an enhancement in the quality of the skin and subcutaneous tissue. These regenerative properties makes this therapy the most innovative, powerful, and safe aesthetic treatment. All the Seffiline kits come from the original technique Seffi and microseffi, superficial enhanced fluid fat injection. This technique, I standardized and published these techniques in 2015 and 2016. The concept is that if you harvest the tissue with a cannula with big side porthole, we are going to harvest a big cluster of cells. And this big cluster needs manipulation to be fluidified and to reduce the dimension of the cluster. But if you use the special cannula of Seffi and microseffi special cannula, is a super thin cannula with a super small side porthole, you go to select very small cluster. The dimensionless cluster is extremely, is a very small cluster. And this determines that you have a tissue that is fluid with a small cluster. When you harvest the tissue with the Seffi and microseffi cannula, the tissue is already fluid enough and you need any kind of manipulation to inject this tissue through needles and microcannula. But why is so important to have a very fluid tissue when you have to perform the regenerative therapy? The fluidity of the tissue is extremely important because you have to inject the tissue as superficial as possible. When you inject the tissue as superficial as possible without, of course, any risk of lumpiness and irregularities, you have to use a superfluid tissue. This increases the engraftment rate, the regenerative effect, and obtain wider indication. When you inject for example, if you inject the big cluster, of course, can occur that the inner cells necrosis. Injecting superficially the tissue, you improving the effect of collagen and glycosaminoglycan produced by fibroblast and improve vascularization. And last but not least, if you have a very fluid tissue, you can inject all the area of the face, because as you know, there is the different area of the face have different thickness in the skin and in subcutaneous tissue. For example, the periocular area, we have a super thin skin and no subcutaneous tissue. And so if you want to inject this tissue superficially and without any risk of lumpiness and irregularities, you need a superfluid tissue. Regenerative therapy is an innovative technique, and for this reason require validated studies. We published several studies in a scientific journal, and we proved that the growth of the stem cells, the growth rate of the stem cells, the capacity of stem cells forming colony, the capacity of these stem cells to differentiate towards the mesenchymal lineages. And last but not least, we evaluate the number of stromal vascular fraction cells and the stem cells for ml of adipose tissue. The concept is that SEFFI and microSEFFI is a minimally invasive but is a surgical procedure. But in my vision of the regenerative aesthetic medicine, I think that this kind of procedure can also be performed by aesthetic physician. And for this reason, I standardized the SEFFILLER, that is a medical procedure. As I told you, SEFFI and microSEFFI are surgical procedure, because the first step of this procedure is a kind of minimal liposuction. It's a freehand liposuction, and so required surgical skill. But when you perform a SEFFILLER, thanks to the special patented guide, it doesn't require any surgical skill. The guide is my personal patent, Italian patent, and now I'm going to show you, to explain this guide. When you insert the syringe and the cannula inside the guide, the cannula comes out 15 millimeters from the edge of the guide, and the cannula is away 15 millimeters from the blade of the cannula, of the guide, sorry. And when we insert the cannula through the little hole in the skin, the guide prevents any risk to insert the cannula too deeply. Moreover, after you insert all the cannula under the skin, the guide grants to harvest the tissue in the correct plane. And which is the correct plane? The correct plane is the most superficial as possible, because there are studies that proved that if you harvest the tissue, harvesting tissue in the superficial layer, yielding an average of 150,000 to 250,000 stromal vascular cells per ml. And now I'm going to introduce you the new SEFFILLER 0.0, SEFFILLER 3.0, but also the SEFFILLER 3.0, because the guide is a heart of every Seffiline kit. This is a new guide. You can see that the guide is a new polycarbonate, is a new material, a medical polycarbonate, is completely transparent, and so you can appreciate the tissue when going inside the syringe during the procedure. Another important upgrade of the new 3.0 guide is this part of the guide. You can see that in this part of the guide there is a little hole. When you insert the cannula inside the guide, you can see that the cannula go through the hole, and now the cannula is attached to the guide. During the procedure, you know that during the procedure you have movement in a fun way. This avoids any kind of bending of the cannula on the attachment on the syringe. And so with this upgrade of the guide, the cannula is attached to the guide, and so there is any bending when you perform the procedure. Another important upgrade in the new guide, the 3.0 guide, is that the blade is larger than the previous guide. This blade avoids of the guide any bending during the procedure, so you cannot bend, and so you cannot change the deep of the cannula during the procedure. The third upgrade in the guide is this line marked on the blade. This one indicates the maximum extraction of the cannula during the procedure in order to maintain the little hole of the cannula inside the skin. When you perform the movement back and forth, you know that you have to stop the extraction of your cannula from the little hole of the skin when the line reach the hole of the skin. And so you are sure that all the hole of the cannula stay inside the skin, inside the tissue, and so your syringe doesn't lose the pressure. Another change in the 3.0 kit is the harvesting syringe. This new harvesting syringe is an auto-lock plunger, and so you don't need to maintain with your hand or maintain with a device. It's enough to pull out the plunger, rotate the plunger a quarter clockwise, and the plunger is locked in aspiration position. And so with this change, it is more easy and more faster to perform the procedure. The last important change in the 3.0 kit is the cannula. The cannula is completely redesigned, the new material, but most of all, change the attachment. The attachment is a special medical polymer connector that guarantees the maximum air tightness when you connect with the syringe. And so you maximize the aspiration of the syringe and the effectiveness of the procedure. These are the great enhancement, the great upgrade in the 3.0 Seffiline kit. Now I'm going back to the SEFFILLER procedure. Talking about the amount of cell that we are going to administrate to our patient, you have to consider that in 1 ml of harvested tissue, you have 150,000, 200,000 cells of stromal vascular fraction and stem cells. The average volume that we inject with a SEFFILLER treatment is more or less 4 ml. Hence, you consider that you are going to administrate to your patient more or less 800,000, 1 million cells of stromal vascular fraction and stem cells for treatment. The average treatment for patient is 2 treatments per year, but I suggest not less than 1 treatment, not more than 4 treatments per year. You can see some cases. When you talk about the regenerative therapy, you have to consider that constancy is more important than volume. And so it's more important the constancy of the patient than the volume that you are injecting in the treatment. This is a post-month, post-op. You can see here, after 6 months, you can see the incredible enhancement of the tissue, incredible enhancement of the quality of the skin. Here you can see after 1 year, the improvement in the perioral area of the quality of the skin and volume. You can see here, after 36 months after the treatment, you can see the terrific enhancement of the quality of the skin and the tone and the enhancement of the volume. You can see also here after 36 months of therapy. And in this case, again, constancy is more important than volume. After 13 years of the regenerative therapy, the quality of the skin is much better than 13 years before. Now I'm going to show you the video procedure. Now I have to stop sharing and go to the video. Sorry. Okay. Share screen. Okay. This is the video of the procedure. I can explain you all the procedure of SEFFILLER. This is the new guide. I already presented the upgrade of this guide. Of course, you have to connect the syringe, the cannula to the syringe with the harvesting syringe with the auto lock plunger. Insert the syringe inside the guide and lock the syringe to the guide. After that, you insert the cannula, rotate and insert the cannula under the skin. The guide stop the penetration of the cannula, 15 millimeters. Now you pull out the plunger, rotate clockwise in quarter, and you can start the procedure. The movement is a fun movement. You maintain the blade touching the skin, and you are sure that you are harvesting the tissue 15 millimeters deep, where there is, you can see the tissue inside the syringe. After that, you transfer this tissue in another syringe, because you have to use this syringe for harvesting, and so you have to harvest more tissue. So you transfer the tissue with all these parts are inside the kit. You transfer the tissue, you wash the tissue, you fill it up the syringe with saline solution, and you put in the syringe stand for a few seconds. After a few seconds, you have the separation of the washing liquid to the tissue. You discard the washing liquid, and the tissue is ready to inject without any need of manipulation, because the cluster is enough small. And so you can, if you want, you can fluidify a little bit. It's not necessary, but in case you can do this. And after that, you transfer the tissue in a smaller syringe, because of course it is more easy to inject the tissue in a smaller syringe. Okay, now we are going to return to our presentation. Okay, very well. Stop here. Sorry. Okay. Okay. Then, of course, there is some special protocols, because you can combine SEFFILLER with our techniques. For example, with hyaluronic acid, microneedling, and threads. The concept with the association of hyaluronic acid. We tested 3 different kinds of hyaluronic acid, and we proved that all these kinds of hyaluronic acid boost the growth rate of the stem cells. Why you can decide to combine the SEFFILLER procedure with hyaluronic acid? When you have a patient that asks for immediate enhancement in volume. For example, you have a patient that comes in your office and asks, okay, doctor, I like your regenerative therapy, but the next week I have an important party, and I wish to have a little bit of more volume in the cheek, in the malar area. And this is the case when you can combine with hyaluronic acid, because hyaluronic acid give you the short-term volumizing effect, but the long-lasting volumizing effect comes from the SEFFILLER. You can see some cases. This is a young lady asking me for a party the next week of the treatment, and so I inject hyaluronic acid combined with the SEFFILLER. But after 3-4 months, the result come from the SEFFILLER and not from hyaluronic acid. This is another case, a young girl that asking me for the enhancement volume in the next week, and so. But after months, the effect, the volumizing effect, comes from the SEFFILLERs and not from hyaluronic acid. Again, in this case, the enhancement of the quality of the skin and the volume come from the SEFFILLER and not hyaluronic acid. Hyaluronic acid have only the capacity to give the enhancement volume in a short term. Another good combination is with microneedling, or for example, laser resurfacing, which you prefer. The concept is that you are going to stimulate the fibroblasts from the outside with the microneedling or laser, and you inject a carpet of stem cells under the skin. The combination of these two activities have the best result when you have a very aging skin, like in this case, or for example, for the barcoding perioral area, like in this case. You have an enhancement of the quality of the skin thanks to the combination of the two treatments. Here again, the perioral area, you can see a dramatic improvement of the quality of the skin. The combination with thread, we'll talk about Dottoressa Rosalba Russo. She's the queen of medical lift, and so she will present this combination of treatment. In conclusion, SEFFILLER is a unique device for regenerative medicine designed for aesthetic physician without any surgical skill. And this is thanks to the patented guide. This is the unique device, all-in-one is disposable. You find all you need inside the kit, and so you can do in your facility without any needs of surgical facility. You have in the 3.0, you have a new cannula, a new harvesting syringe, a new guide. And this procedure comes from Seffi technique, and so the special cannula no needs any manipulation of the tissue. And last but not least, the guide, the tissue harvested in a superficial layer, thanks to the guide, yielding an average of 150,000 to 150,000 stromal vascular fraction and stem cells. Now I give the floor to Dottoressa Rosalba Russo, and after that I'm coming soon with SEFFI Air. Thank you very much for your attention. Okay, can you hear me?
Do you hear me? No? Okay, thank you. Okay, good morning, good afternoon, everybody, and welcome to this webinar organized by Seffiline. And before starting, I would like to thank Dr. Gennai for his kind invitation, and a quick hello to all colleagues who are now connected. As you already know, our patients come to us with complaints about wrinkles or change in facial volume, or perhaps a change in the quality of their skin. So this is why their only common aim when they undergo treatment is to look younger. As you can see, every face requires different treatment according to individual needs and aging process. Here we can see a woman aged from 20 to 70 in just a few seconds, but this is exactly what happens over the course of a lifetime. In order to contrast the aging process, we need to have a good knowledge of anatomy, and above all, remember that the subcutaneous fat is compartmentalized, as Rorich and Pessa have widely stated. As you can see, we divide in superficial fat compartment and deep fat compartment. Superficial fat compartment are infraorbital, medial, and the lateral cheek fat compartment, middle, and superior and inferior jaw. Here you can see on the cadaver. The deep fat compartment is the medial SUF, the lateral SUF, and the deep medial cheek fat at the end, the buccal fat. Here you can see the same on the cadaver, exactly on the cadaver. But it's very important to understand how do the fat compartment age. It's important, the aging of the medial group of the superficial fat compartment is characterized by downward migration, ptosis, and hypertrophy. Only the lateral temporal cheek fat compartment is here, is characterized by hypertrophy and does not a tendency to migrate downwards. It's very important to remind that the superficial fat compartment, the only treatment you can do is the medical lifting. You have to tighten this compartment and reposition superficial fat. About the deep fat compartment, the age of this compartment of the maxillary area, lateral medial SUF and deep medial cheek fat, is basically characterized by hypertrophy and slide down, non-downward migration over reabsorbing bone. And the only treatment you can do here is the volumizing effect on the deep fat compartment. Another important thing is about the retained ligament. When we're treating the patient with threads, it's important to remember about the retained ligament. In order to contrast the aging process, we can employ a series of combined treatment which require a good knowledge of anatomy and good knowledge about the retained ligament. And you can see here the deep threads insertion is when you insert the threads, you have to insert in a superficial compartment, and you have to give a traction in the zygomatic cutaneous ligament to tight the zygomatic cutaneous ligament and the masseteric cutaneous ligament, because they are very strong and you can have a good tightening effect. So another important thing is about this retained ligament. This retained ligament age and relax and contributing to a modification of the face. We can see that they are responsible for this modification and cause sagging. And the areas, the greatest interest for traction is the nasolabial fold, is the marionette line here, and the jowl. This is the area that most of the time the patient are asked to improve their face. Mine is the same. This the retained ligament, we have to distinguish in true and false ligament. The true ligament are the orbicularis, zygomatic, mandibular, and buccal maxillary. All the other one are false. And here you can see how ligament relax. You can see here how the face show proper stigma. Here you can see the correct insertion where you can insert the suture. Here you can see how happened during the aging process. The face doesn't age in the same way in the same time. As you can see, the first one is the periorbital area, and then starting the orbicularis area, and the atrophy of the temporal lateral area. So this is why our face changed during the time. The solution when we treated the face of the patient is a global correction in order to have a good personalized corrective action on the face. So SEFFILLER, as my friend Dr. Nye said just a few minutes ago, is a medical procedure with a special protocol. You can associate this with hyaluronic acid, with microneedling, and particular in this case, my topic is with threads to have a good result. The medical lift is the combination between stem cells, the new technology, you improve the skin quality and give a mild volumization, and the combination with bidirectional suture, tightening and fat repositioning. The regenerative aesthetic procedure for facial rejuvenation, as you can see, and as Dr. Genai said, adipose tissues is our goal. Is very important for us, and for me is one. When I saw for the first time, I say this is the fantastic treatment for our patient, because when you have to treat the periorbital area, you don't have any treatment in your hand. With SEFFILLER, you have a good treatment, and patient come to ask to improve their periorbital area with SEFFILLER. So. As this is the new guide, is very safe, is very easy, and you can use just for monkey, because you improve, you learn just the one time, and then you continue to use it. Very easy to do. Okay, you can see in 4 milliliter the average volume injected in a SEFFILLER. You have a minimal cell dose of 800,000 cells of stroma vascular fraction. This is the new guide from Alessandro. Is very important to prevent any risk to go too deeply on the abdomen, and is very important to in this treatment enhance the area where you are going to treat. You can improve the temporal area, you can improve periorbital area, you can improve the face, the neck, and the décolleté. This is very important. And the cannula was born just to select a small cluster of fat. There is 0.8 millimeter, and there is not manipulation. This treatment, depending on the patient, on the condition of the skin, and you can do 1, 2, or 4 treatments per year. This is important. When we speak about the threads, it's very important to consider the area to be treated. So most of the time you have to improve the nasolabial fold, the superior and inferior jowl. This is the area most important treat, because when the patient asks to improve the nasolabial fold, to correct the jowl, and when you speak about threads, this is the area you have to concentrate your goal. So you can see you have a slide of this superficial fat compartment, and how you can tighten this. This is the vector that normally you have to use. And where you insert this suture, you have to insert in subcutaneous level, superior, medial, or deep, because if you go too deep or too superficial, the patient feel pain, and in the dermis or in the muscle. So, and you come back with the cannulas. You can see the aging face, the ptosis of the soft tissues enhance the nasolabial fold and the marionette line, and the ptosis of the chin and the lower chin modify the jawline. This is the reason why patients arrive in our office. So this is a very nice nice picture, because you can see how the inferior jowl fat drop during the aging process. And this is why we have to tighten this area. When you use SEFFILLER, you improve the zygomatic area, you improve the quality of the cheek, but you can need to lift the jowl, because otherwise you don't have other solution for this, not only the surgery. Here you can see the hypertrophy and fixed area, and here the ptosis and hypertrophy and suspension area, nasolabial fold and jowl, superior and inferior jowl again. What we have, a global improvement of the patient face. The technique is not invasive, minimal downtime, and is very easy technique. This is our case study. You can see this lady with a global moderate sagging, volume loss in the middle. Treatment goal is restore first, restore the skin quality, then restore the mid-face volume, and redefine the jawline. My protocol in this lady was first stem cells, after 15 days bidirectional threads, and I put 3 threads for each side. This is the other pattern technique. Is possible to use mild, moderate, or severe sagging, depending on the skin patient and on the ptosis of the lower face. And you can use 1, 2, 3, or 5 sutures. And this is the classification of fixation of this double fixed threads. Is the new generation of the threads. You have a floating threads, are very easy to insert, is less dimple, or the anchoring threads. The double fixed pyramid threads are 2 kinds of threads. The first one is in PDO, improving the neocollagenogenesis, and the grade in minimal in 12 months. About double fixed PCL is known as a strong collagen stimulator, and degrade after 24 months. Is a very long-lasting result. This is our double fixed threads. A pyramid is very, very nice, and this amazing pyramid anchoring, supporting, recontouring, medical lift, and collagen stimulation. You can see the difference between other threads with our PDO ultrasound threads. Here again is very defined. So here you can see how is our threads, the bidirectional PDO or PCL threads. It is a very new one. As I said, different are resorbable for each one, but the most important, they totally degrade after 24 months for PCL and after 12 months for PDO. So these two solutions in combined use, depending on the phase to be treated, and give a global rejuvenation of the patient face. The advantages of this thread is a very strong tension capacity, less criteria of bad candidate patient, more indication, longer durability, user-friendly, easier to insert, and a conical needle, you have less bruising in this case. And you have, this is the linear pattern technique for the mid face. The anchorage is always in the temporal area, depending what you want to improve. If you want to improve the nasolabial fold or the jowl, you can put one or two, depending of the patient, or finger pattern technique. For a very heavy skin, you put 3, 4, or 5 threads. The planning of treatment is very important. Identify the safety lines, identify the target area, identify the entry points and the exit point, and at the end to have to identify the reshaping line that will be the path of the threads. How to identify the safety line? You can see SL1 from the lateral canthus to the cranium, or SL2 from the medial canthus to the modulus, and SL2 run to the fascial artery on variable anatomy. So, and then the anchoring ligaments are in the middle of the cheek. When you want to improve the cheek area, you have to tighten the platysma auricular fascia, the platysma auricular ligament, and the parotid cutaneous ligament. In this case, you reposition which compartment, the jowl, the medial cheek fat, and the middle cheek fat. Again, the anchor ligament in upper part of the cheek, you improve, you have to tighten the masseteric cutaneous ligament, the zygomatic cutaneous ligament, and the mandibular ligament. In this way, you reposition the jaw compartment, inferior compartment, and the medial cheek fat compartment. I want just to underline the platysma auricular fascia and the platysma auricular thread, because it's important for you. Remember, he's here and here. The different, because sometimes ask me, but there is not a platysma auricular fascia, there is not auricular ligament. So, and this is another way to insert the sutures. The same in upper and lower cheek. You can see you can tighten the platysma auricular fascia, platysma auricular ligament, and the cutaneous ligament to reposition also in this case the jowl and the medial cheek fat. How to identify the reshaping line? R1, like in this case, from in to out 1, from in to out 2, and at the in point, enter again, and exit in out 3 and out 4. Sorry, okay. Identify again R1 in this case when you put in U technique, entry point from in to hem, and from hem to out 1, and from in to out 2. this is the area where you have to tighten, if you want to tighten the jowl and you want to correct the nasolabial fold. Every time inside the reshaping line. Here you can see another kind of reshaping line, R1, R2, and R2 from in, to, and out, R3 from to out to. Is so difficult. Entry point in the corner of the jawline. Exit point, the first exit point is in a pre-jowl. So you enter again in here, and then you go towards the preauricular area, enter, exit, and enter again with your needle, and you create a virtual knock. And then in straight line, you improve the nasolabial fold. Sorry. Then here you can see the patient that I treated with SEFFILLER. You can see first we have to must extract the adipose tissues, adipose cells with the cannula is present in the kit, and then you improve the area with a cannula. You can see you must emulsify with about 15-20 passages between one syringe and another, so as to make the adipose tissues as fluid as possible before inserting in the area to be treated. So then you insert after 50 days, insert the sutures, enter, exit on the first exit point. This is a PDO thread. Enter again in the same entry point in a view technique, and exit. In this case, we are going to improve the jowl. I put the needle to avoid to lose my threads. And then I pass through the loop with another thread and anchor. I'm going to anchoring in the temporal area. Pass through, as you can see. In the same, with just one entry point, you put the two threads, and you can have a good tightening of the jawline with a good anchoring in the temporal fascia. This is the case, the result before, immediately after SEFFILLER, and after the combination with SEFFILLER and threads. In the same patient in lateral position, you can note the quality of the skin, the improvement of the quality of the skin and the jawline in this case. Okay, just the other side is fantastic, the improvement of the quality of the skin. Other patient before, after 3 months, and after 6, just with SEFFILLER. Just with SEFFILLER. The other side, and this is before, after SEFFILLER, after 15 days, the combination with threads. Look, take a look at the difference, the quality, the improvement of the jawline, improvement of the marionette line and the nasolabial fold, and the periorbital area. Other patient is 68 years old. The improvement, the quality of the skin first, and then the jawline and the marionette line. I concentrate all my tools in this area. This is a patient very young, 45 years old, but she is very skinny face. It's difficult to find fat in this patient, but I find it, and then I create this combination with threads. A very nice result in the lateral position. This patient I treated just with SEFFILLER before 15 days, after 2 months. Other patient in combination, the volumization in the zygomatic area and the tightening in the jawline, the other side. Other patient, just to show immediately after the combination. The combination you can do in the same session or in 2 sessions, depending on the patient, depending what you want to do. Normally, I prefer in 2 sessions, but if it's possible, you want to improve the zygomatic area and then you want to improve the jawline, you combine SEFFILLER in upper part of the face and threads in the lower face. Take home this message: embracing the procedure, incorporating a minimal invasive procedure, and it's very important the training program. First, you have to do the training. SEFFILLER improve the quality of the skin. A double fix give us a good lifting effect. And it's better to propose to the patient that doesn't want any surgical procedure. Patient selection is very important because you can propose to the patient have from moderate to mild to moderate aging process. And in most of the case, the patient have an advanced aging. It is impossible to propose this combination, but in that case, you propose a surgical treatment. The synergy between double fix threads and the SEFFILLER is magic in my opinion. And SEFFILLER you can combine with threads, you can combine with botulinum toxin upper part, you can combine with hyaluronic acid like my Dr. Gennai said, and you could have a good reshaping of the face. About the medical wisdom, every face is different. You have to think about and to have a good plan for each kind of skin, each kind of patient. And I finish. I want just to underline the next webinar is on the 16th of June, where we are going to speak about the same, about SEFFILLER, about threads with my friend, Dr. Teguh, is from Indonesia, and is a very international, another international webinar. Thank you for your attention.
Thank you, Rosalba. Okay.
Thank you, Ale. Stop share. Okay. Share. Okay.
Thank you. Thank you for it's a great presentation, Rosalba, and awesome cases. You are really the queen of threads, and I think that the combination of SEFFILLER and threads in your hands gives a very awesome result, and it's the future of the medical lift.
Thank you.
It's a pleasure. Now I'm going to present the SEFFILLER 3.0. Share the screen again. Okay, the SEFFILLER 3.0. Okay, is the regenerative therapy for androgenic alopecia. As you know, androgenic alopecia affects 70% of men and 40% of women of all ethnic groups. And this disease is characterized by the progressive miniaturization of hair follicles and in selecting the area of the scalp. And of course, there is a genetically predisposed individual. I don't want to bore you with the hair growth cycle, but the only thing that you have to know that when you have the androgenic alopecia, we have the shortening of an anagen phase and the lengthening of the telogen phase and resting phase. Of course, the pattern of the alopecia in men and women is different. And sometimes, sorry? Okay. and the pattern is different, and so of course the protocol of treatment is different for men and women. The cause is often multifactorial, of course. Of course, can be the stress, lack of micro and micronutrient, but the most important thing is the synergy of two molecules that damage the hair bulb, the hydrotestosterone and prostaglandin D2. And of course, these two molecules is the most important factor in the alopecia, androgenic alopecia. Of course, in this case, androgenic alopecia can be treated with a combined protocol, but the most important component is the regenerative medicine, the center of all the other kind of therapy. Is the most effective and the most safe therapy. Of course, you have the conventional treatment with the finasteride and minoxidil, and also physical adjuvant treatments are carboxy therapy, photodynamic, and microneedling, and also the regenerative therapy. You can use the regenerative therapy also combined with hair transplantation. We have 3 important European centers that combine hair transplantation and SEFFILLER procedure and regenerative procedure. Is in Italy is Dr. Piero Tesauro in Milano, Dr. Eugenio Gandolfi in Chiasso, Switzerland, and Dr. Felix Popescu in Romania, Bucharest. Here you can see some evidences of the role of regenerative medicine in alopecia therapy. The stem cell, the adipose-derived stem cells, play a fundamental role in the anagen induction through the stimulation of hair follicular stem cells, but also play an important role the fibroblast growth factor in the cure of the alopecia. Last but not least, is extremely important also the vascular endothelial growth factor for the increasing of the vascularization of the scalp. Recent study proved that there is an interesting result with regenerative therapy also for the alopecia areata. The thing is, the difference is between the SEFFILLER and the SEFFILLER procedure, that when you treat the regenerative procedure for androgenic alopecia, the volume is not required. And so it is possible to transfer the cell of the stromal vascular fraction in the liquid portion of the tissue, and so is more easier and painless to inject the stromal vascular fraction cells without the tissue component. The procedure of harvesting tissue and preparing tissue is exactly the same. You use the same cannula, the same guide, but the important step number 2 is the emulsification. You have to create a mechanical digestion of the tissue. So you have to pass it 20 times from one syringe to another through the connector. The connector has any filter. We don't need any filter because the plaster is enough small. The emulsification is kind of a mechanical digestion of the tissue. After that, you have to centrifuge for 10 millimeters, 3,500 RPM. You can find the tube inside the kit SEFFILLER, and so after the centrifuge, you have the passage of the transfer of the stromal vascular fraction cells from the tissue component to the liquid component. This is extremely important because after that, and of course we proved this passage of the stromal vascular fraction in the liquid portion, we have a study that proved that if you don't emulsify the tissue, you don't have the passage of the stromal vascular fraction in the liquid portion. But if you do before the emulsification of the tissue with 20 passages from one syringe to another, you have after the centrifuge the tissue, the stromal vascular fraction go through the liquid portion of the tissue. So when you extract the tube from the centrifuge, you can use the long needle that is inside the kit, the SEFFILLER kit, and you going to harvest only the liquid portion inside the tube. And so you're going to fill it up the syringe with the liquid tissue rich in stromal vascular fraction cells. After that, with a micro needle, it's 4 millimeter length and 27 gauge, you can inject the stromal vascular fraction in the scalp of the patient. Some annotation for the procedure is you use a syringe that inside the kit, you use the needle for millimeter length, 27 gauge is inside the kit. The injection is 45 degrees through the scalp, so it's not perpendicular, but a little bit is 45 degrees. You inject more or less 0.5 ml of tissue per spot, 1 centimeter distance every spot. And another important trick, and when you inject, after you inject, you stay more or less 2 seconds before to extract the syringe. Okay. Of course, the number of treatment during the year depends of the condition of the alopecia, but at least is 1 treatment, but not more than 4 treatments per year. Some result with only the treatment with regenerative therapy, you have some result you can see here, and so this therapy is easy and effective, and you have to combine selection of tissue, emulsification, and centrifuge. And so the stromal vascular fraction cells move from the tissue to the liquid portion. And more or less, with this technique, you are going to administrate to our patient in 4 ml of tissue, 2,000 to 600,000 of stem cells. Now I'm going to show you the procedure. Sorry, one moment. Now I go to show you the procedure. Okay, one moment. Okay, that's it. Okay, go share the screen. Yeah. Okay. Okay. Now, at the beginning, the procedure is exactly the same of SEFFILLER. You have to harvest the tissue with the same guide, the same cannula, and you are going to harvest the tissue. I can take off the sound. Okay. Okay, you connect, of course, the cannula to the syringe, the auto plunger lock syringe, insert in the guide, and you perform. This part is exactly the same of the SEFFILLER procedure. So you have to maintain the blade touching the skin. You lock the plunger, and maintaining the blade touching the skin, you can move under the skin in a fun movement, and you are super safe and super sure that your cannula is moving in very safe plane. After that, you have the tissue inside your syringe. Okay, extract your syringe, you transfer in a syringe, wash the tissue. After that, you have to wait the separation of the washing liquid to the tissue. And now the procedure for the SEFFILLER is quite different of SEFFILLER procedure. The procedure for SEFFILLER is quite different from SEFFILLER procedure. When you have the tissue, now you connect with the connector that is inside the SEFFILLER kit. And after that, you have to do 20 passages between one syringe and the other. This is a mechanical digestion of the tissue. And so you have to perform 20 passages between one syringe to another. This is to disgregate the cluster like a grape. And so after you transfer the tissue inside the tube, you cover the tube. Of course, all these parts are inside the kit. You centrifuge 3,500 RPM for 10 minutes. After that, you have the stromal vascular fraction is passed in the liquid part, and now with a long leader that is provided in the kit, you can go in the bottom of the tube and you harvest the tissue. Now you have the tissue is ready to inject, and so you can perform the injection in the scalp with the short needle 4 ml and 27 gauge. The injection with a so small needle is quite painless, and so you can inject all the area that you desire. Okay, return to our presentation. Okay, very well. Okay. Now, the procedure, step one, first of all, number one, the SEFFILLER is a unique device that is meant for aesthetic physician and dermatologist for the procedure without any surgical skill. Thanks to the guide, is disposable only one, the same of SEFFILLER, and it's the device for hair loss regenerative therapy that yields the greatest amount of stromal vascular fraction now on the market. And of course, I wish to announce the webinar of Dottoressa Rosalba Russo, the Tuesday, the 16th of June, and she will present, of course, the SEFFILLER, but also the latest generation of ultrasound thread. Thank you very much for your attention. For any need or for any answer, you can contact me in my private email. You can see here in the last slide, and you can contact me and we can share our experience in autologous regenerative aesthetic therapy. Thank you very much.
Thanks to everyone for your attention. If you're interested, feel free to contact us at our email address, info@seffiline.com, and we will direct you to the closest distributor, and we will provide all the info about prices, delivery, and shipping times. Please feel free to register on our Facebook page, SEFFILLER Expert Club, or on Instagram or LinkedIn, and visit our website, seffiller.com and seffier.com, available in English. To all of you who attended the webinar, we will send an email with all our contacts and info, so we will be in touch with you in the next few days. The webinar you just attended will be online and available on our website. We will inform you as soon as the recording will be online. Thank you very much. We do hope you enjoy, and we will be in touch very soon. Good afternoon, and thank you for all your attention.